And when it comes to diabetes, what, if you could put it, maybe three of the most important things that you teach other medical professionals, what would those three things be that are important, you feel is important for them to understand?
So perhaps the most important thing to understand for them is diabetes is not like any other disease, in that you can not simply tell the patient, take this medication, like we often can do in many other diseases. As an endocrinologist, I treat patients with hypothyroidism, and I would advise them to take thyroid supplement, and as long as they do it once a day, that's the treatment. With diabetes, medications are very important, but that's only part of treatment, and many patients can be managed without medications at all. Treatment mostly involves significant adjustments of their lifestyle, but in a way that wouldn't impact their lifestyle negatively. I always tell them, you shouldn't let diabetes run your life. You should live your life as you want and then adjust the diabetes treatment to those needs. So in that sense, diabetes is not like any other disease. The second thing to understand when you treat patients with diabetes is that only about less than 10% of them nationwide are treated by specialists, which is almost nobody. 90% of people with diabetes are in primary care setting, never see an endocrinologist. So primary care doctors need to be very aware of how this disease is managed. And the third thing is they shouldn't try to do it all themselves. They should try to get help wherever they can from perhaps regional medical centers, pharmacies, any other places, of health professionals who can help them educate the patients. And these educators could be nurses, nutritionists, exercise physiologists, pharmacists, even lay people who can be trained to do that. We had a grant once where we trained lay people to become coaches for patients with diabetes, which was very successful. They helped them remember to take medicine, explain why and when they should take them, and so on. So don't do it alone. Try to see if there's somebody who can help you. Otherwise, it's a very time-consuming, difficult job to do all by yourself.